I would love to cover today is to learn a little bit more about the aspirational ideals you have for your company. It's an amazing things you're bringing to the world. And I like to put it under the category of what we call telling your story, right? So we find out, what's really unique, what's powerful, what's scalable, what's the world impact that you'd like to have um, with this fabulous, AI-driven diagnostic technology. And so I would like to start with, the aspirational ideals you and your team have set for this company as you go forward. What are the big things that? How would you like to dent the universe?
Great question, David. Yeah, actually, I started this journey a few years ago, back in 2013, with my father. This is when I started Mammotest. And our dream at that moment was to democratize access to high quality healthcare. We knew that through technology we could, reach people that couldn't be reached before, implementing the use of technology in healthcare. So this is how we started at that time with my father. And of course, Mammotest has evolved so much from that day uh, until today. And we still believe in democratizing access to high quality diagnosis. Of course, nowadays we have access to technology that could make it even more possible than it was at the time we started with my father back in 2013. Today, AI, it's really, as many people say, it's a great equalizer. So if you implement AI in the right way, you would be in a position to really democratize access to high quality diagnosis worldwide.
So, in terms of democratizing it, I assume you mean every woman on the planet would have access to this at an affordable price, if not part of the healthcare system. Is that correct?
Yeah, it is in part correct. And this is how we started, because Mammotest in the beginning was looking to drastically decrease the number of women dying of breast cancer. And in order to get that, we needed to democratize access to early diagnosis. So, and I say in part because today we have evolved to a point where we are not only addressing the diagnosis of mammograms, but we are also taking care of the more broader aspect of the shortage of medical doctors in radiology. So we are also doing interpretation through our tech arm, which is Boulder AI. It's a platform that we developed and we launched it back in 2023. We are taking care of also of MRIs, CTs, ultrasound, and X-ray, not just mammograms. So today, that early dream we have with my father back in 2013, 10 years later, broadened to more modalities, such as the one I mentioned. So today, it's democratizing access to high quality diagnosis of imaging in general. And this is a huge problem, not just in the developing world where we started in emerging economies, but also in the rich countries like in Europe, where aging population and a shortage of medical doctors for interpretation of imaging, it's creating a huge pain in the healthcare sector, and it's creating a bottleneck that is hard to solve.
Wow. I have to share with you, when I first got out of college, my first project was working with a company called ICFAR, who was pioneering ultrasonic breast imaging in Indianapolis, Indiana. They were the first. It didn't work very well, but it was a noble effort. So I was super excited when I heard what your aspirational ideals, the mission statement of the company. In terms of best practices, is there any city, country on the planet that is really developing what you'd call best practices around your solution that could be shared to the rest of the world?
Well, this at this point, I would say it's difficult to generalize, to say this country is doing the right thing. I mean, and I'm speaking about the countries where we are operating. Of course, I cannot speak about the countries where we don't have operations, and I don't know what they are doing. But in general terms, it's hard to say this country it's doing right and this one is doing wrong. I would say some institutions and some medical organizations are doing right. Others are a little bit behind. And of course, and as you know, in healthcare, it's always slower. The adoption of technology is slower. It always has a slower pace. If you compare it to other industries, it's always behind other industries in terms of adoption of technology. Of course, there is always, a 5 to 10% of the healthcare industry that it's really well ahead of the rest. But then the 80 to 90% of the industry is always behind. And you can right now we are operating in Latin America and in Europe. In Latin America, we are operating in Argentina, Mexico especially, and we are just starting in Costa Rica and Brazil. And in Europe, we are operating in Spain. And I would say that in Spain, the healthcare industry, of course, it's more mature than in Latin America. It has better resources and funding, so they can adopt, and they have maybe an open mind when it's about adopting technology in order to get the right results and to get to democratize access to high quality diagnosis, shorten times, and decrease the cost of interpretation of images in that country. If you go to Latin America, well, it's the pain is the same. It's imaging diagnosis. It's a bottleneck. I mean, every time someone goes to a doctor, 70% of the times you visit the doctor and they would ask you to go and get some kind of image, and then that creates a bottleneck that because the patient goes to the facilities, they perform the image, and it could take from weeks to months in order to get the report back, and that slows the whole process of getting to a treatment or whatever you would need after that image. So it is a huge pain also in Latin America, but of course the adoption of technology takes much longer because of mainly two things, I would say. One is the funding that is not always there in emerging economies, and the second one is maybe the how open-minded they are when you are speaking about adopting new technologies such as AI. So those are the differences I can tell in when I'm speaking about countries where we are operating right now. I don't really know about other countries, other economies, but this is what I know from our practices.
Okay, and then I assume to really democratize it, take out a lot of customer friction. Like you said, you have to go to the doctor, you get a recommendation for an image, you got to get in line. It's at least in the countries I've worked with, there's a lot of customer friction with the insurance agency, the government approval process, all of these things. You envision a day where MammoTest would eliminate the doctor, the insurance company, the government, and just do the imaging lab, let's say, with your patients, and do the diagnosis, the whole thing, and greatly reduce the friction in the value chain, if you would.
Yeah, I mean, I think that in the future that could happen. This is not what we are trying to do at this point. I think there are a lot of things that we need to do before getting to that point. As I said, MammoTest started focusing on breast imaging. Now with Boulder AI, our tech platform, we broaden our scope, and we are also into MRI, CT, ultrasound, different types of images. What we are trying to solve at this point is the shortage of medical doctors for interpretation of images. And the thing that with the aging population, that it's gonna create more demand of imaging diagnosis. So we are focusing on solving that pain today for the medical institutions. I know there is friction. Today our business it's a B2B, so we are selling to hospitals and clinics and sometimes governments, like in Mexico, where we work with the IMSS, that is Instituto Mexicano del Seguro Social, it's the Social Security Mexico. And of course, we are trying to make it easier for them to solve this pain, this huge pain, this huge bottleneck, in order to get patients to treatment as fast as possible at the lowest possible cost. And Boulder AI, today it's a marketplace, let's say an imaging marketplace that is focusing on the efficiency of the logistics of those images. So we can accomplish the goals that I earlier mentioned of, decreasing the cost, shorten the times, and augmenting the quality of the interpretation of imaging. So those are the kind of problems we are solving today. What you mentioned, of course, the friction that there is in the healthcare industry, it is very important. It is other type of problem, other pain that we're gonna have to address at a certain point. But of course, you cannot, and especially as a startup, you cannot try to address every problem in the industry, in the space. So for now, we are focusing on solving that bottleneck that I just mentioned.
Okay, so so I'd like to also talk about the customer perspective, which is both the patients and the hospitals and the insurance companies and the government, but also from the investor perspective. What message? I assume as a startup, you're always looking for new investors to help globalize, take the message out faster. What message do you have for the investors that they should support you on this noble quest to democratize diagnostics?
Sure. Actually, the good thing about what we are doing right now is that this is not a promise. This is not something we say we're going to do in the future. We are already doing this. We are solving the bottleneck in imaging, the imaging diagnosis space. We are solving this in Europe and in Latin America, in the countries where we operate. So, and I want to stress this part because these are very different scenarios, Europe and Latin America, but our solution is capable of solving the problem in rich countries and also in developing economies. As I said before, shortening the times to diagnosis, so patients can get to treatment before, lowering the cost of doing the interpretations, and increasing the quality of the interpretation of imaging diagnosis. So this is a very important point when speaking about multi-geography, let's say. It means that Boulder AI, our platform, could be global. The solution could be global. The other good thing about this is that it's not just validated in different types of economies, in the healthcare area, but it's also validated by the type of investors we have behind. We have Merck Sharp and Dome, we have Philips Foundation, we also have Johnson & Johnson Impact Ventures behind Mamotes and Boulder AI. And this is something that really validates us, and also as on the institutional investors side. So this is something very important when speaking about healthcare solutions and startups.
Yeah, I think everything you mentioned has, from the customer, the hospital perspective, huge return on investments in terms of faster diagnostics, catching cancer at early stage, and having more effective treatment options. Have you done any case studies that would show return on investment from a hospital perspective or a government perspective?
Actually, we did we did a few different case studies. Right now, we are working on one that is gonna be very important. Is the job we're doing with the IMSS, the Social Security in Mexico, specifically in Baja California, which is a state in Mexico, where we are operating with 10 different hospitals. And this is going to be a great success case of how we can implement our technology in the public sector in Latin America for addressing the underserved population and getting what I said before, shortening times to diagnosis, lowering the cost, and increasing the high quality. This is really democratizing access to high quality diagnosis, even in underserved population. So we are working on that one. We also, in the past, we did a case study that was published with a British medical journal. But yeah, those are the kind of case studies that we like to work on in order to share, so other countries and maybe other governments would like to implement the solution we are implementing. But we are not just implementing our solution on the public healthcare sector. We're also doing this with the private sector. Like I mentioned before, we are operating in Spain, where we work with private clinics and hospitals. Maybe they are hired by the government in Spain, but we are operating behind the scene, doing the interpretation of images for these customers too.
Yeah, I think you have a powerful message for all people on the planet, right? Certainly the governments would love that message about bringing healthcare to everybody. We work with a number of governments at Frost and Sullivan, where they look at how would we start healthcare from scratch, right? Is it a single payer system? Do we eliminate the insurance companies? Things like that. And I think the technology you're bringing to bear kind of addresses that kind of thing. If we were to start from scratch in a country with no healthcare system at all, it seems that your solution would be very powerful in terms of disintermediating some of the very expensive elements of a national healthcare system, whether it's insurance or highly paid doctors, whatever. How would you envision that message? If one of the things we'd like to do is help you share your message with the countries, with the politicians, the political people in the healthcare system, as well as the investors around the world. It sounds like you have some tremendous startup investors, as well as the patients. So as we look at that country message, do you have any thought leadership on, if you did it from scratch in a country, how would that work around your technologies and your solution?
Yes, actually, what we are proposing governments in general every time we speak with them, it's, look, we are making your life easier, because this is Boulder AI, our platform. It's a marketplace. It's a one-stop solution for imaging diagnosis. You only need to connect your medical devices such as MRIs, CTs, ultrasound, or mammography units to our platform, and in connection with our platform, we have a network of medical doctors for interpretation of medical images, and they are specialized and subspecialized in different images. And of course, we develop AI in order to help these medical doctors do interpretation with higher quality and a faster pace. So we can increase the efficiency of the system in general. So by being this one-stop solution, we kind of solve a big problem that there is in the healthcare industry. That is the multi providers, a lot of providers for the same thing. Nowadays you can find in the marketplace in around the world, many startups and companies developing AI solutions for specific types of images, and I mean, can you imagine, a hospital or a clinic trying to decide at this point which one is the best AI they could use? It would be a nightmare to do that. So what we are proposing at this point is, okay, here you have our marketplace, our platform, where you can connect your hospital or clinic, and you will have there, the medical doctors you need in order to do interpretation, but you also these medical doctors will get access to different AI tools, our AI tools, and also third parties AI tools that will be on the market. And the medical doctors are the one that will make use of these AI. So the government or the clinics, they don't have to choose which one. We have agents that are going to do that work, that job for them, because they're gonna choose what is the best AI tool in order to do interpretation of a certain type of image. So we are looking for efficiency in general terms. The good thing about our solution is that we've been in the market, we've been in the trenches, we say, because we since day one when we started Mamotes, we were developing the solution was completely different. We were installing medical centers where we would have mammography units, and then we would connect all these mammography units with teleradiology. So we ourselves were dealing with hiring medical doctors, hiring staff for the management of the medical centers. We were trying to bring patients to facilities, trying to locate patients so we could give them the reports once they were done, dealing with different medical insurance and governments in order to get reimbursement, all that kind of pains that are the typical pains that a medical institution would have or a government would have. So we know exactly what's going on there, and we now decided to start developing the solution and implementing the solution so they wouldn't have that kind of pain anymore. We know the pain they are going through, and we know how to solve it. And this is something that I haven't seen in the market. We are always trying to solve what we know is going on there, and it's not just trying to develop a solution that in theory would be the best solution, but in practical terms, it's not possible to implement, or it's not very easy to implement. And this is really the difference between success and failure, I would say.
Yeah, I think, clearly you have an incredibly powerful solution, and you have a very profound, mission statement to democratize diagnostics of mammography. As you said, it can be a very competitive landscape, right? A lot of copycats. Pretty much every company on the planet tags AI on their solution now. How do you mentioned a little bit that you're the only company on this space. If I'm the head of a hospital group, how do you explain to me, what makes Mammotest unique? What's your solution that's unique, that separates you from the rest of the crowd?
Yeah, I would say not Mammotest, but Boulder AI, our platform. It's a one-stop solution. You wouldn't need to do anything else. Just acquire the imaging equipment. It could be MRI, CTs, ultrasound, or mammography units, whatever you need in your facilities, and you just have to connect your equipment to our platform. And we would do we would take care of interpretation. We would take care of you getting high quality reports for the images, and we would take care of the shortening the times so you can get these reports and have your patients happy and arriving in time to treatment. So if you're a government, you would be by shortening the times, you are lowering the cost, because if patients get earlier to treatment, is usually less costly than if they arrive late. You would be saving lives. This is if you are a government. If you are just a private clinic or hospital, we would be giving you a chance to maybe perform more images, because we would be doing the interpretation at a faster pace with a higher quality, and you wouldn't have to be focusing on managing a large force of medical doctors for interpretation. You wouldn't have fixed costs as salaries. You would only need to, get connected to our platform in order to get that solution. This is like, I always, when I speak with medical institutions, this is like Uber for interpretation of images. You get connected and you forget about this. We're gonna take care of the interpretation of the image, and we're gonna make sure it's gonna be of high quality and in less than 24 hours.
Yeah, fabulous. If I wanted to ask you what keeps you up at night, if there's any obstacles that if you could have your dreams come true, obstacles in front of Boulder, what keeps you up? What's your biggest headache? What's your biggest challenge that you would like to get solved?
Yeah, actually, I would say I don't even sleep. It's not a actually, yeah. Of course, there are many things, obstacles and barriers that keep me up at night. One of the things that I'm more obsessed at this point is making sure I'm doing the right hiring. We are in a very competitive landscape. It's difficult to get the right people, especially in AI. In order to develop, we need to develop so we can better serve our customers. So this is something that really keep me up at night, and it's being good at hiring. Taking I know that we shouldn't be hiring fast, but the problem is nowadays you have to be really fast. You have to be developing fast, implementing fast, failing fast, and trying again. But at the same time, you know that hiring is something that shouldn't be that fast, because you have to make sure you are hiring the right people. I mean, I made this mistake in the past of hiring fast, and in my opinion was one of the biggest mistake I made as an entrepreneur. It's like they say, it's hire slow and fire fast. Well, I didn't do that before. Now I'm making sure I do that, even in the middle of this uncertain world, very fast-paced world where everything goes really fast, and you have to make sure you have the right resources, and the right resources are the right people actually in order to develop this.
Yeah, no, it's a fascinating issue. One of the things that, as a side issue, we might be able to help you on is the hiring, especially if you're looking for AI professionals. Mangesh heads up a company in Nepal that is focused on AI support projects. So if you're interested in that, we might connect you on that if that's something you want to look at. But much more cost effective, and really, really good people. So if you're interested, I'll introduce you guys on that front if that could be a help.
I'll appreciate it.
Yeah, you're welcome. The key thing for us is that we make a really powerful transcript, white paper, video from our conversation today. So what I'm always looking for is you have a very, very powerful mission statement and aspirational ideal of democratizing. Then, how do we scale it? What makes it unique? We know it's powerful. And then what if the world can help you, where do you need the help? So if it's on hiring, maybe that's a place that, in the transcripts and the white papers, we can talk a little bit about, the key challenges. Same on, go ahead.
Yeah, as an entrepreneur and a startup, we always have more or less the same problems. One is, the human resources. The other one, of course, is funding. You always need funding in order to grow faster. But most importantly, it's, I would say, network. The healthcare space is not, I don't see it as a space where you get to sit with the right people that could hire your solution or get connected to older AI just by doing advertising. It's a place that requires more trust, let's say. So what's working very good for us at this point is word of mouth. People telling other people from one institution to other institution, telling them, hey, these guys are good. They are solving my problem. You should get connected to this solution. And that kind of door opening, it's maybe one of the most important things that I'm looking for today.
Yeah, I think you're absolutely right, because I've spent the first half of my career in imaging, and the most influential thing for imaging was a top doctor that would recommend it or had case histories or said, hey, this is the thing to buy. And then the rest of the doctors would run like sheep towards your solution.
Exactly.
Delete that from the video. But but yeah, that's hopefully what we can try to do is pull, as you see these case histories, we'll be working with you to identify those and tell the world about it. So is there anything, as we wrap up here, is there anything, Guillermo, that you'd like to cover, that questions I should have asked but didn't ask, that would really take your story to the world?
Actually, I think, David, you covered most of the questions I would think of. So yeah, I think we're okay. I don't know. Maybe you have another question, but I think we covered pretty much everything, right?
No, I love, we work with startups all over the world, and the biggest thing is letting the world know the solution is there, right? And that's what this whole recognition award is all about, is telling your story to accelerate the solution, because we know people all over the planet need this solution, right? They need a more cost-effective way to screen and catch cancer before it goes from stage 1 to stage 2. And you're in the middle of a great value to society. So thank you for that. And we'll be working on this. We may have some follow-on questions that we'll probably do on text or email. And if there's any breakthrough stories you'd like to include in it, let me know, and we'll move forward that. But anyway, thank you very, very much for your time.